The ballroom shimmered with chandeliers, polished silver trays gliding through the air as servers wove between tables. Holiday music played softly in the background, a gentle contrast to the murmurs of investors, executives, and employees dressed in their finest. I had never been to the Bridgewell Gala before 5 years of service finally earned me an invitation. When the CEO, Phoebe Landry, took the stage, the room quieted instantly. She carried herself like royalty, her emerald gown catching every spotlight. "Tonight," she said, voice smooth as silk, "we honor dedication, loyalty, and innovation. And for 5 years of remarkable service, we have something special for Adira night." Applause rose around me as I pushed my chair back. My legs felt oddly heavy, but I forced myself to the stage. A small red gift box sat on the podium, tied with a satin ribbon too elegant to be anything but deliberate. Phoebe handed it to me with a smile that didn't quite reach her eyes. Cameras lifted. A colleague near the front already had his phone aimed squarely at me. "Go on," Phoebe urged. "Open it." The ribbon slipped loose in my hands. I lifted the lid. My breath caught as the weight of the room shifted. Not a watch. Not a token of appreciation. A neat stack of papers lay inside, stamped in bold red letters. Notice of termination. A ripple of laughter spread through the tables. Someone whispered, "This is gold," while another leaned in for a better view of my reaction. My fingers trembled, but I forced them steady as I picked up the papers. Phoebe held out a pen. "We'll need your signature," she said lightly, as though this were all some kind of joke. I looked at her, then at the sea of smirking faces. 5 years of nights spent alone in the lab, 5 years of canceled dinners with my son, 5 years believing in the work reduced to a punchline. I signed. My name glided across the page in one smooth stroke. Handing the pen back, I leaned toward the microphone, my voice even. "Thank you for the opportunity." And, "Good luck with the FDA audit next week." The room went still. Phoebe's smile cracked, just for an instant. I turned, stepped down from the stage, and walked toward the exit. The weight of 5 years pressing against my chest as memories of what had led me here stirred. The winter air outside the hotel bit against my skin, but it was nothing compared to the sting in my chest. 5 years, I thought. 5 years of pouring everything into Bridgewell. As I walked down the icy sidewalk, the memories came unbidden, unspooling like a cruel film. I had given them 60-hour weeks without hesitation. Nights hunched over assay results, chasing down anomalies while the janitors vacuumed around me. Vacations canceled with a curt email to my son, Ezra, explaining why we couldn't go. He never complained, but I knew he noticed. He learned early that my absence was the price of keeping our modest apartment, of paying his tuition. I told myself it was temporary, that every late night and every missed birthday dinner meant a more secure future for him. When I first joined Bridgewell, it felt worth it. The company's reputation gleamed. I believed I was safeguarding lives, ensuring that every medication that left our labs was safe for the people who needed it most. There was pride in that, real pride, the kind that made the fatigue tolerable. Then Phoebe arrived. She swept through the glass doors one Monday morning, flanked by assistants, her perfume arriving seconds before her voice. She spoke of efficiency, acceleration, market readiness. In boardrooms, she dazzled with slides of upward curves and polished sound bites that made the executives lean forward, hungry. She knew how to package science as spectacle, and they adored her for it. For the scientists who lived by data, she was a storm. Deadlines shortened, testing cycles compressed, questions brushed aside. Where I saw careful validation, she saw obstruction. Where I flagged uncertainty, she stamped it acceptable variance. She turned colleagues into cheerleaders, convincing them that speed was compassion, that every day saved meant suffering eased. At first, I admired her confidence. She seemed untouchable, the kind of leader who could bend the industry to her will. But admiration soured. I began to notice small things, the way inconvenient reports disappeared from shared drives, the way critical questions never made it into official minutes. What I had once dismissed as polish began to look like deliberate misdirection. And then came the first anomaly, tucked inside a stack of routine test results, waiting for someone stubborn enough to notice. It began quietly, just numbers on a spreadsheet. I was reviewing routine stability tests for Luminex, our golden ticket pain medication, when I noticed the same irregularity surfacing across 3 separate batches. The compound was breaking down faster than it should, producing metabolites that flagged under toxicity markers. At first, I thought it was a calibration error. I recalibrated the equipment, ran the controls, repeated the tests. The anomaly persisted. Each time I rechecked the data, the picture sharpened under conditions simulating the human liver. Luminex was producing byproducts that could damage tissue. Subtle. Yes, but consistent. For a patient taking the drug daily, especially someone older, the risk wasn't hypothetical, it was inevitable. I compiled the results and filed a formal report through our quality assurance portal, normally within hours. I'd receive an automated acknowledgement, followed by a reference number. This time, nothing. I refreshed the system. Still nothing. By morning, the entire submission had vanished as if I'd never uploaded it. Confused, I resubmitted again. It disappeared. No trail. No acknowledgement. That evening, as I packed up my bag, the screen of my monitor blinked with a new message. The sender's address was scrambled. Impossible to trace. Only one line stared back at me. Remember Thomas. He raised concerns. He disappeared. My throat tightened. Thomas Delgado had been a colleague in quality control. A year earlier, he had raised red flags about irregularities in another medication. Officially, he'd been let go for performance issues. Unofficially, he vanished from the industry. His number disconnected, his LinkedIn erased, no forwarding address. I stared at the words, unease sinking into my stomach. Someone not only knew what I was finding, but also wanted me to remember the cost of pressing further. I closed the message and shut down the computer, but the words followed me out into the cold night. And the next morning, when Phoebe's assistant summoned me to her office, I already knew this anomaly was no longer just about data, it was about survival. The invitation had not been for me. I was only asked to prepare briefing materials for the executive retreat at Lake Pinewood, a resort 2 hours outside the city. But I delivered the binders myself, hoping a face-to-face handoff might give me one last chance to be heard. The conference room door was ajar, voices spilling out into the hallway. Phoebe's tone carried easily, smooth and confident. The Q4 timeline is ambitious but achievable. We'll have FDA approval by December if we move forward now. My pulse quickened. One of the board members asked, "And the anomalies in testing minor variances," Phoebe said without hesitation. "Nothing that affects safety or efficacy. The profit potential here is enormous. First to market means we own this category for years." I pushed the door wider. 7 pairs of eyes turned toward me, startled. I clutched the binder to my chest. "Those aren't minor variances," I said, my voice steadier than I felt. Batch 457 showed liver toxicity at standard dosages. We need expanded testing before this drug ever sees a shelf. Phoebe's smile was brittle. "Adira, Thank you for dropping these off, and we won't keep you. I didn't move. People could get sick. We can't ignore this." She tilted her head, her voice sharpening. "Some people value bureaucracy over healing patients. Every day of delay is another day someone's grandmother lies in pain. Is that really what you want on your conscience?" The CEO frowned, turning to Phoebe. "Is there a real safety issue here?" "Absolutely not," she replied smoothly. "Adira is thorough, which we appreciate, but she's misinterpreting standard variances. I've had independent reviewers confirm the results are within parameters. That was a lie." I opened my mouth to protest, but Phoebe's eyes met mine across the room. There was no anger in them, only promise cold, unmistakable. "Pursue this, and you will not survive it." I swallowed the words that burned in my throat and left the room, the lake wind cutting my face as I stepped outside. If the system itself had closed its doors to me, then I needed to find another way to fight. After the retreat, I knew I couldn't fight this alone. My instincts told me that if Thomas had been erased for speaking up, I would be next unless I found others who still cared about the science. It started with Kai. I caught him outside the lab one evening, his eyes darting nervously as though even the walls were listening. "I saw what they did to you," he whispered. It wasn't right. His voice cracked when he added, "My sister has chronic pain. She'd be first in line for Luminex. I couldn't just stand by." Then he slipped me a flash drive. I downloaded the original trial data the night you were fired. If they knew, I'd already be gone. That single act of defiance lit a spark in me. A few days later, Juno pulled me aside in the parking lot. She had been with Bridgewell longer than both of us, her loyalty unshaken until now. "You weren't wrong," she said quietly. "I've run the numbers too. The anomalies are real. I didn't know what to do, so I buried the printouts at home. I still have them." Her hands trembled as she admitted it, but her eyes held steady. Through whispered conversations and coded text messages, more threads began to weave together. Reed, one of the younger lawyers, confessed that the confidentiality agreements surrounding Luminex were unlike anything he had ever seen, clauses designed to muzzle dissent. And Talia, from clinical trials, admitted that dozens of patient complaints had been downgraded before reports were finalized. "I read the original forms," she said. "People described symptoms consistent with liver damage. Somehow, by the time they reached the database, they were marked as mild headaches. One by one, they surfaced, drawn together by unease and a shared sense of betrayal. We met in out-of-the-way cafes where the chatter of students masked our words, and sometimes in the back of Reed's cousin's bookstore, surrounded by towers of forgotten novels. There, our scattered fears began to take shape as a plan. For the first time in months, I didn't feel alone. And as we huddled over coffee-stained tables, I realized we weren't just saving our consciences. We might be the only one standing between Phoebe's empire and the people it could destroy. I knew where I had to turn. When the walls of Bridgewell closed in on me, there was only one person I trusted with the truth, Dr. Eliza Ward, my former graduate advisor. She had shaped the way I thought about science, drilling into me that integrity mattered more than recognition. I reached out under the pretense of catching up, but when I met her in her cluttered office at the university, I laid out the evidence, the test results, the anomalies, the missing reports. She leaned back, her expression unreadable, then said simply, "Leave me samples. I'll see for myself." The waiting nearly broke me, but when her call came a week later, her voice carried the weight of confirmation. "You're right, Adira. Under metabolic conditions. The breakdown products are toxic. It's not borderline, it's significant. Relief and dread washed over me in equal measure. Now I had proof. but proof alone wouldn't be enough. When I met with Kai, Juno, Reed, and Talia in the back room of the bookstore, we laid out the options. Reed shook his head. Internal channels won't work. Compliance reports get filtered before they ever leave the building. Regulators, Kai offered, they'll send it straight back to Bridgewell for internal review. Reed said bitterly. Talia stirred her coffee. Then we need someone who can't be silenced. Someone who knows how to shine a light. She looked at me. What about Zoe Harper? The name made us all pause. Zoe had made headlines the year before, exposing contaminated antibiotics. The manufacturer had tried to ruin her, but her reporting held. She was fearless but also cautious now. After being dragged through lawsuits, I agreed to reach out. Days later, I sat across from Zoe in a quiet park, the winter air sharp against our cheeks. I told her everything, watching her face as she listened without interruption. Finally, she closed her notebook. You understand, she said slowly. If I take this on, your career in pharmaceuticals is finished. No one will hire a whistleblower. I met her gaze. My career ended the day Phoebe handed me that box. The weeks blurred together while Zoe worked methodically, chasing down leads, interviewing former trial patients, and verifying every scrap of data Eliza had confirmed. My role became quieter, preparing for the moment when everything would collide. I dyed my hair a darker shade, chopped it shorter, and hid behind thick glasses. When the catering company posted temporary positions for the gala, I slid my altered resume across their desk. 2 days later, I had a uniform, an apron, and a schedule. The night of the event, the air outside the Boston Grand Hotel was alive with light and the crunch of tires on ice. Inside, the ballroom glittered like a jewel box, crystal chandeliers, velvet drapes, polished marble floors. Guests arrived in sleek black cars, draped in jewels and ambition. I entered through the staff door at the rear, carrying trays of champagne flutes. Security glanced at my ID badge, but one guard squinted at me a moment too long. "Do I know you?" he asked, suspicion flickering in his eyes. My throat went dry. "First night on this crew," I said lightly, balancing the tray as though its weight demanded all my focus. He hesitated, then shrugged, motioning me through. My legs shook as I crossed into the service hall. Too close. On the floor. I blended into the tide of black aprons and white shirts. The scent of roasted duck and sugared pecans filled the air as servers fanned across the ballroom. I kept my head down, collecting empty glasses, scanning the crowd, the board, investors, even FDA officials, all the power in one room, laughing beneath chandeliers. Then she appeared. Phoebe glided in fashionably late, her emerald gown catching every spotlight. The CEO kissed her cheeks, raised a glass, and called her the woman of the hour. Applause thundered as she took her place at the head table, radiant, untouchable. From across the room, I caught Kai's eyes. He gave the faintest nod, the kind of signal only meant for me. I tightened my grip on the tray, steadying my breath. The night had only begun, and everything we had built was about to unfold. The clinking of glasses signaled the height of the evening. Phoebe rose from her seat at the head table, emerald gown shimmering under the chandeliers, a picture of triumph. The CEO stood beside her, beaming as he declared, "Tonight, we celebrate not just innovation, but history. Bridgewell has received final FDA approval for Luminex." Cheers erupted, champagne foamed, and applause swelled around the room. Phoebe lifted her glass high, her smile sharp as a blade. "To Luminex," she said, "to innovation, to changing lives." That was the moment Zoe stepped forward. The press badge at her collar caught the light. Her voice, clear and firm, sliced through the applause. Zoe Harper, Health Investigations. Batch 457, 6 times the reported toxicity rate. Care to explain? The room fell silent. The sound of champagne fizzing in crystal flutes was suddenly deafening. Phoebe froze mid-toast, glass hovering in the air. The CEO blinked, his mouth opening and closing like a man searching for a script. "Excuse me. This is a private celebration," Phoebe began smoothly, but her tone wavered. Zoe held up a folder. "Independent labs verified these results. I have copies of the original reports that vanished from your records." Across the ballroom, the FDA officials shifted uneasily, exchanging sharp glances. Then Kai stood. His voice carried across the hall. "I worked on those tests. The data was altered. I have the originals." Juno rose next, her gray hair catching the light. "I saw it too. The anomalies weren't mistakes. They were erased." Talia followed, her words steady. "Patients in the trials reported symptoms that never made it into the database. I logged them myself." A ripple of gasps coursed through the crowd. Phoebe's grip faltered. The champagne glass slipped from her hand and shattered against the stage. I stepped forward, tugging off the glasses and apron that hid me. I didn't falsify data. "Phoebe." I made sure the truth wasn't buried. All eyes swung between us, the weight of silence pressing down as the power she thought untouchable began to crack. The ballroom dissolved into chaos. Investors shoved back their chairs, murmuring into phones as they headed for the exits. The FDA officials gathered tightly, their expressions grim, one already dialing a number with urgency. The CEO sputtered about baseless accusations, his voice drowned out by the hum of panic. Phoebe found her footing and pointed straight at me. "She's a disgruntled employee who was terminated for obstruction. She stole proprietary data and manipulated it to get revenge." Her words dripped with venom, her eyes fixed on me as though she could erase me with sheer fury. For a moment, I felt the room tilt. Doubt flickered across some faces. Then Reed rose from a back table, his voice even but firm. "As counsel, I can confirm that Bridgewell is legally required to retain all safety files for regulatory inspection at any time. If the data Miss Harper and these employees reference is fabricated, producing the originals tonight should resolve the matter immediately." Silence followed. Phoebe's face hardened, but no rebuttal came. The CEO's hands gripped the podium, knuckles pale. One of the FDA officials stepped forward. "We'll need access to the servers now." The statement landed heavier than any toast or accusation. It was no longer a debate. It was an order. Security shifted uncertainly, and for the first time, Phoebe looked trapped. I didn't stay to watch the final unraveling. The din of voices followed me out into the frigid night. The hotel's festive lights glowed behind me, muffled now by distance and snow. My phone buzzed in my pocket. I typed quickly, "Is it over?" Kai's reply came almost instantly. "The FDA is inside the servers now. It's begun." I stood under the winter sky, breath curling in the dark, knowing that nothing in my life or theirs would ever be the same. Months later, I sat beneath the harsh lights of a congressional hearing room in Washington. The seal of the United States loomed over the dais, and every seat in the gallery was filled. My hands rested on a stack of documents, the same kind of data that had once been erased without a trace. Now, it was evidence. The committee chairwoman leaned toward her microphone. "Ms. Knight, your testimony has been invaluable. Can you tell us what could prevent this from happening again?" I steadied my voice. "Regulations aren't the problem. It's enforcement. Scientists must have protected channels to report concerns without fear of retaliation. Independent verification should be standard, not exceptional." Murmurs of agreement rippled through the chamber. By then, Phoebe had already been indicted on charges of fraud and data falsification. The company's stock had collapsed by half, its reputation in shreds. The CEO had resigned, board members were under investigation, and Bridgewell was no longer untouchable. When the hearing concluded, a woman in a navy suit introduced herself as Dr. Naomi Chen, director of the newly created Pharmaceutical Integrity Commission. "We need people who understand both the science and the stakes," she said, pressing a card into my hand. "I'd like to discuss a leadership role with you." 1 year later, I unlocked the door to my new office in the Commission's headquarters. Sunlight spilled across stacks of case files waiting for review. My nameplate on the door read, Director of Quality Review. The last item I unpacked was a frame holding the termination papers Phoebe had handed me that night at the gala. I hung it beside my degree, the 2 pieces of paper telling the story of where I had been and why this work mattered. This was my gift back, I whispered, touching the frame. The phone rang on my desk, pulling me into the work ahead, and I knew that sometimes the truest revenge wasn't watching their downfall, but building something stronger from the ashes.